My name is Pipit Carlington. This is my first official YouTube video, other than the ones that I've made up till this point that have been slideshow videos, but the first live video type video. Um, and I just want to tell you about my experience with Emory Healthcare and let you know what has happened to me. This has been absolutely devastating. I have been chronically ill for years. About 12 years ago, almost, I'd say maybe 13, I almost died of sarcoidosis. I didn't know what it was. I was having one system of my body after another malfunctioning. I was having to go in and out of the emergency room, doctor to doctor. They didn't know what was wrong with me. And eventually I was referred to a rheumatologist that was connected with, I'm trying to think of the name of it, that was connected with another facility, Dept Medical Center. I just had a brain fart there for a second, but Dept Medical Center. He was the one that first diagnosed me with sarcoidosis, a rheumatologist connected with them. And then I ended up in the ER once more at Emory, and they referred me to a primary care clinic. I got connected with a physician there, a primary care physician, who at the time saw me. I was very ill. It was very clear that I was very ill. And initially, he was very nice. He was very understanding. He really wanted to get to the bottom of it. And he said to me, quote unquote, "You're not crazy. There's something really seriously wrong with you. You're very ill." And he ran a bunch of tests, and there were some markers that came up positive, like rheumatoid factor and some, I think, blood in my urine. There were a number of other positive, lab tests that came out. I then had a gallium scan, which showed, intensity in various different organs of my body of inflammation. And along with that and a number of clinical signs and symptoms, he agreed with the rheumatologist about the diagnosis. And I continued to get worse. He tried me on steroids briefly, and I had severe side effects. It caused a rage reaction, and I just couldn't take the risk to continue with that type of medication. So I looked for another solution, and I found the Marshall Protocol. And it took a while for him to really get on board with that, but it got to the point where things just got so severe and I was suffering so badly that, yeah, he went ahead and agreed to write the prescriptions for it. And within 2 weeks, I started to feel significantly better, and it worked wonderfully at that time, and I really am thankful. I'm really thankful to Trevor Marshall, who came up with that, because it saved my life at the time, and it worked really well. And but then when Medicare Part D came along, my medications had been covered by Medicaid, and I didn't have any trouble getting the medications that were part of this protocol until Medicare Part D took over for dual eligibles, people on Medicare and Medicaid. And so their regulations were different, and they no longer allowed off-label prescribing. Benicar was the main drug in this protocol, and I had to have it at a much larger dose than what they generally prescribe for high blood pressure. And so it got to the point where it was inaccessible. I couldn't continue to get it because I would have had to have been paying out of my pocket over $100 a month, and I just couldn't afford that. I mean, I make less than $800 a month on disability, and I had to just not continue it anymore. I hoped for the best. I dropped back on my activity level. I tried to control it with diet as best as I could. And I just had to hope that things would be okay and that, you know, I wouldn't destabilize again. Just, without, being on official treatment. And I thought that I was managing it. I thought it was okay, and that, you know, that I was able to get my life enough on a manageable level. I had to kind of adjust to a new normal, um, and not push myself as hard, not get out as much. I had to be sort of accept that I had to be a lot more sedentary, that I had to be pretty much in bed. But I thought I was managing it. And then about a year ago, things started to get worse. And I thought that it was my sarcoidosis. I didn't know for sure. But I had, in addition to the symptoms that I had before, it's a multi-system disease, so it can affect any part of your body at any time. In addition to those symptoms that I had had almost 13 years ago, when I first started the Marshall Protocol, I developed some new symptoms. I was sent for a sleep study by my primary care physician. And at the time, I thought that referral was kind of off base. I didn't really understand the connection with it. I didn't really feel like I was going to come out with sleep apnea or anything like that. But I went pretty much just to please him and thinking that maybe at least we'll rule this out. And so at first, initially, I had to go to a pulmonologist with Emory Sleep Medicine. And it ended up that when he ran the sleep study, I was really shocked, but it came out grossly abnormal. He told me that I went in there, and when I went to see him, in the office, he said, this is not the kind of sleep study that we like to see. And he said this, he kept saying, this is not good. This is not good. And I said, what? And he showed me the report, and he explained to me that, that I had what they call Bios breathing or Bios respiration, which is similar to Cheyne-Stokes. It's a breathing pattern that often shows up in people that are really seriously ill and possibly dying. And it indicates usually something wrong in the brainstem, either in the pons or the medulla. And he did a brain scan. He ordered a brain scan, and they didn't find anything in that. But then it seemed as though from that point on, he didn't really seem too worried about it. But my symptoms continued to escalate. And I had also, in addition to those breathing problems, I also had hypoxia. And he had said that my hypoxic burden was extremely high, that I was having a lot of breathing stoppages, and that I was spending a lot of time hypoxic, and so he was concerned about that. And as time went on, I began to have shortness of breath, not only at night but during the day too. And he had uh, tried a CPAP titration, and uh, what we found out was that actually that actually made me worse. Not only did it not help, and it really didn't improve the situation. It actually made all of the symptoms worse, and my sleep study the second time was even more abnormal than the first one. And it on top of that, it felt like it was sucking the air out of my lungs rather than blowing the way it's supposed to. And as a result, afterwards, it threw me into respiratory crisis for several weeks after I went home from that second sleep study where they did the titration. So we talked, and he suggested the possibility of trying me on oxygen at night. And I said, well, okay, I think that might work better because it's a more gentle type of ventilation. So I'll try that. So then there was a long process that we had to go through in order to get authorization for my primary insurance for Medicare to cover it. And I had to go through, first they went through this walk test where I think you have to have an oxygen saturation. I don't remember what it was, but it was, some really low amount, in order for 5 or 6 minutes when you're walking down the hall. And this was before I started having mobility problems, but I'll get more to that later. So that didn't show up because the tech kept telling me to breathe, breathe, breathe. And part of my problem is that I don't breathe, when I'm not consciously thinking about it. I don't breathe the way other people normally do. I mean, you're not supposed to have to think about it. It's supposed to be an automatic system in your body where your brain sends the messages to your muscles that you need to breathe. And my brain doesn't do that. And to this day, they don't know why. So of course, because the tech was telling me to breathe the whole time and I was consciously doing it, then it didn't really meet the criteria for 24/7 oxygen, which at the time I really needed because I was really gasping for air. I was having a hard time with shortness of breath during the day as well, and it was really, really miserable. And so the next thing they had to do was try to get me certified at least at night for when I'm sleeping, or any time when I'm sleeping, basically. So that criteria wasn't quite as difficult. That wasn't as stringent. So what they had to do to get me certified for that was order a home monitoring where they hooked me up to O2 saturation type monitor, and then monitor me for 6 or 8 hours at night. And so it took about probably 2 months before they could get that arranged, because they had to get Medicare to approve that too. And they finally did, and they got a medical equipment company to bring over a monitor for that. I hooked myself up that night, and sure enough, that came out with, I think I went down to about 80 oxygen desaturation that night several times. And so I met the criteria for that. And so then I was approved for oxygen for sleep. So I am now actually, let me see if I can show you my oxygen unit that I'm on right now. Let's see here. Let's see if I can, yeah, there you go. You can see in the corner, that is my oxygen concentrator. I have now had that for, gosh, let me see. I'm trying to think when that was. Um, Probably close to a year now, something like that. And it helped me considerably when they did the next sleep study, the third one. Um, they found that my oxygen saturation was pretty good after that. I had, I think, maybe one or two episodes, but the episodes were cut way down, and so the oxygen has been very effective for that. But they also, in the third sleep study, they found that there had been some uh, additional problems that I think that were not necessarily found in the earlier sleep studies, or maybe not as severe in the earlier ones as in the third one. They found that my because I had been having myoclonus, and that had, I noticed that somewhat during the first sleep study, but it kind of gradually came on. I didn't really know, I couldn't really identify when it started, but I noticed at first it was just happening some nights and not all nights. But then in the third sleep study, by that time it had gotten really severe. And that was one of the reasons, besides, checking to see how the oxygen was working with my hypoxia, they wanted to see if they could, I guess, get some idea of what was going on, why I was having this jerking at night when I was trying to fall asleep, because it had gotten to the point that I was jerking like really violently in my arms and legs, and sometimes even my torso, um, every time that I would try to fall asleep. And it was like just as I would drift off. And this was happening for a while there. It was happening for 7 or 8 hours. And I wouldn't be able to finally fall asleep until it kind of wore itself out around 7 in the morning. So in the meantime, I was looking for a neurologist who could manage my this myoclonus and find out maybe what was causing it. And there was a neurologist that I was recommended to see that was connected with sleep medicine in that same department as my pulmonologist. So I went to see her, and we talked, and she looked at my sleep study tape for herself. She was able to go into the next room and view it, and she said, yeah, she said, this is myoclonus, and she put it down initially, I think, as sleep myoclonus, although it was happening outside of sleep under certain circumstances too. It also happens when my upper body gets too cold, and it happens if I'm lying on a hard surface for very long. I have that, and I also have some other abnormal movements that are slower and just more kind of like dystonia type movements in my back, where my back kind of arches. Sometimes it's slow, and then other times there would be times when I would be standing, and in certain positions, my back would arch, and I would jerk violently back quickly. So, I have some slow movements, and I have some jerking, violent kind of quick movements. Around July, I had I developed some problems with mobility. I started noticing that I was falling just for no apparent reason. I mean, I was just doing normal activities. And one day I went down to the mailbox, um, and for no apparent reason, I just fell while I was walking down to the mailbox. And I, I just, I had no idea, why, because I wasn't tripping over anything. It wasn't like there was an obstacle in my path or anything. It was just as if I put my foot out, and all of a sudden my legs just didn't work. Um, they didn't stop me, and I wasn't able to self-correct the way I normally would. And that was the first clue that I had that there was anything going on with my mobility, with my walking or my legs or anything like that. Before, it had just been respiratory and some other symptoms and the myoclonus and all that. But then I noticed, you know, I guess it may have actually started in the fall. Um, no, it started in the summer, but it was like it extended into the fall. It's hard to explain all this because a lot of this happened gradually, and so I didn't really think a whole lot about it until things started becoming pretty severe and happening repeatedly. Then I fell a few more times, and it got to the point where I fell about 7 times within a period of about 6 months. And I was falling for just crazy reasons. Like one time I was trying to, one time I was trying to just, um, I got out of bed and immediately fell forward. I was attempting to just walk, take a step. And what happened was I continued to go forward. When I put my foot out, I just continued to go forward, and it was as if um, whatever it is that normally tells you to stop and brace yourself didn't function correctly. And I just fell straight forward and hit the ground on my hands and knees. And this happened several more times. And it seemed to be happening when I would try to lift my foot. And it wasn't like I was tripping over something. Like if I was lifting my foot too high, um, even if there was nothing in the way, this happened. And as time went on, I just noticed that I started having strange symptoms in my in the bottom of my feet and my legs. I started having stiffness in my legs. I think it started. I noticed it first in my left leg, and I noticed it first in my left leg, and then um, fasciculations, these little twitches in the bottom of my foot. And it started in one foot, and then as time went on, I noticed it in my right foot, and it seemed like over time, then it started to happen more often in my right than my left. But I remember going into the pulmonologist's office, and I was telling him about this. I said, I've had some very strange symptoms, because the other thing that happened is that I noticed when I was out with a friend of mine, we were just going about our normal business. We were doing some grocery shopping or going out to eat or whatever. And when I got out of her car, I noticed that my hips started dislocating for no apparent reason, one or the other or both. And I would almost fall right where I put my foot down, because it would catch, and then it was as if the hip joint would separate the top from the bottom and just be like flopping around. And I didn't know what that was or why that was happening. It just happened randomly, and I couldn't really connect it with anything or correlate it with anything that I was doing differently or anything like that. So, um, I reported all this to my pulmonologist, who at that time I was working pretty closely with. And at the time, I genuinely thought that he was trying to help me get to the bottom of this. And I got to the point where I really trusted him, and I thought that we had a really good, close doctor patient relationship, and that he was genuinely interested in helping me solve this problem and possibly, you know, diagnose it and treat it so that maybe, something could be done about it. Because it was getting to the point where I was clearly becoming more and more disabled. And it got to the point there where my muscles would cramp up and they would get so stiff and so in spasm that it would ache. My calves and my gluteus muscles in my butt got very, very stiff and achy. They just hurt from how they would just, it was like they would stay tensed up and I couldn't voluntarily untense them. And it got to the point where it was just unbearable to continue trying to walk. And so I ended up having to go to a power chair. And I for the life of me, I didn't know what on earth was going on. I didn't know if it was my sarcoidosis, or I also have fibromyalgia. So I thought, well, it could be that, or it could be something completely new. I didn't know for sure. But as time went on, it seemed as though the symptoms I was having looked more and more like something like ALS. And, I started having all sorts of symptoms that were, very consistent with that. I mean, it was just something that you couldn't ignore. Um, I was having trouble with saliva at night, coming out of my mouth. I would be fast asleep, even with the oxygen on. I would be choking on my own saliva, and that would wake me up out of a sound sleep. Um, Let me see, I had other symptoms too. There were just a lot of symptoms that were just coming out of left field, and I didn't know how to handle it. It was really upsetting, and I felt as though I didn't know what to do to compensate. I was trying to adapt as well as I could to this new level of severe disability. And I didn't, I've been disabled for a while with chronic illness, but this was a whole nother level of disability that I wasn't used to. And I live alone. I don't have help from family and friends in the home. I do now. I finally have a personal assistant, but that took quite a while and a lot of paperwork and stuff to get set up. But at the time, I was completely alone. And here it was, I was finding myself just totally fatigued. I was having this spasticity and stiffness and pain and inability to ambulate. And I was finding that as time went on, it was just getting worse and worse. And I was having trouble at times initiating movement. I would wake up and feel like I needed to go to the bathroom. I had to pee really badly, and I couldn't get my body to respond to be able to sit up and then get up and go to the bathroom, you know, put one foot in front of the other. It was like my brain just wasn't responding. My muscles would not respond to my brain. I knew what I wanted to do, and I couldn't make my body do it. And I just knew. I knew that something was really seriously wrong, and I didn't know what, but it just was looking like some multi-system neuromuscular type disease. And so, I tried to figure out what was going on. I tried to get help from my doctors that I was seeing at the time, and nobody really knew what to do. They didn't know who to refer me to, or, what consults to get or anything. And at the time, I really genuinely thought that my primary care doctor and my pulmonologist were 100% with me, and that they were genuinely as concerned as I was, wanting to find out what was going on and get to the bottom of it and get me treated so that, maybe this wouldn't have to be the rest of my life. And maybe I could, improve at least, if not, cure the condition. Um, but, like I said, I was trying to adapt on a daily basis as things were getting worse and worse and worse. And I talked to my primary care physician and I said, look, things are getting really severe. This was around maybe late September. And I told him, I said, it's getting to the point where I can hardly even bathe myself. I'm having difficulty with activities of daily living, and things that I was fully capable of doing before, I was no longer capable of doing. I had trouble getting in and out of the bathtub. I also started having really severe near fainting spells, near syncope, and I didn't know what was going on. I was, even it wasn't even always positional. I could be lying flat on my back and still, nevertheless, I could still feel intensely like I was about to faint. And then I started noticing nausea coming along with it, and then also this feeling as if I had to poop intensely. And it turned out that that wasn't actually the case. It wasn't like I was going to have diarrhea or anything like that. It was more like spasticity in the colon. And it was just, I would have these episodes where it would just be sustained, and sometimes those symptoms would all come together, and other times I would have some and not the others, and different combinations of them. And I contacted my primary care physician on the patient portal at Emory, and I said to him, I said, this is not good. I said, this is getting to the point where it's waking me up at 3 or 4 or 5 or 6 in the morning, you know, um, and I'm feeling intensively faint. And this is getting really severe. And I said, do you have admitting privileges? I'm really thinking I may need to be in the hospital. And strangely, I don't know, he had been, up until that time, I thought he was really good. And I used to always, when they sent out those surveys, I gave him glowing reviews. And I always felt that he was very supportive and very warm and all that. And then all of a sudden, he started changing. I don't know what it was that caused him to look at me differently, but all of a sudden, things didn't seem quite the same. And he seemed unconcerned or underconcerned, and like he was just sort of sitting on all of this and not acting when things were becoming really serious. And I didn't know how to handle it. I didn't know what to do, because it got to the point where I was going in there and standing up in the shower to take a shower as I normally would. And I'm the kind of person that, hygiene is important to me. I'm used to taking a shower or a bath every single day and washing my hair at least once a week. And it got to the point where I just couldn't do that. Standing up in the shower, I started feeling so faint that I was going to pass out. And I couldn't do that safely anymore. And I went to him and I said, what do I do? How do I handle this? I don't know what to do, because I need more help than I'm having at home. I said, I can't do these things myself anymore. And he didn't really give me much advice. And I felt like I was totally alone with all of this. Here it was, I was seriously ill. I didn't know why. I didn't have the services or the help that I needed at home so that I could manage at home. But I was going to be damned if I was going to end up in a nursing home or someplace, or assisted living or something like that, because I I actually have an advocacy background. I was one of the people who was involved in writing the protection advocacy system here in Georgia um, that was developed in 1986 as a result of a federal protection and advocacy law. Originally it was, to investigate incidents of abuse and neglect in mental health facilities, but it also included some other facilities like personal care homes and all that. I was instrumental in writing that joint contract between the agency that I had at the time, and this was years ago, and then four other agencies that jointly went in together and covered the state of Georgia to take these abuse and neglect complaints. So I have a background in complaint investigation. So I'm not just somebody who just pulled this out of their ass and don't know what they're doing, but I know how complaints are supposed to be investigated. And so I I just found that something didn't something didn't seem right about the way that my care was going. Um, I saw some red flags, but at the time, I just didn't, I hoped that nothing, untoward was going on. And I hoped that it was just innocent, that my doctors just didn't know what to do and that they were innocently trying to help me but didn't know how. That was how I viewed it initially. I didn't think that anything really, sinister was going on. And so I said again to my primary care physician, you know, I'm getting concerned because, I'm getting more and more disabled and, now I'm not able to walk. I can't stand, I can't even sit up in my wheelchair for very long to go into the kitchen. Sit up in the wheelchair, and see right now. I mean, normally I have to have pillows behind my back to prop myself up, because if I'm just holding my core up without any back support, it's too fatiguing. And it would also, back then, it was making my back and my neck muscles very stiff and in spasm. Um, and the primary care doctor, I don't know, he just seemed uncharacteristically oblivious to all of this. And I didn't know if that was something, if he had something going on in his life that was making him distracted, or if something was going on with his job, or what was going on. But I actually thought the best at the time of him. I really thought that he was doing the best he could, and I gave him the benefit of the doubt. And I continued to say to him, look, please, I think we need to start making a plan here, because if I need to be in the hospital, I really would rather not go to the ER. And at the time, I had no idea that anything really horrible would happen at the ER. But I just thought, I'm very fatigued. I don't need to sit there for 3 or 4 or 5 or 6 hours and wait in the emergency room. And if I'm going to be sick, I'd be better off in my own bed at home, where I feel comfortable and where I can rest. And I just didn't want to go through that extra hassle and waiting and all that kind of stuff. And, you know, that was the worst I thought that would happen to me at the ER, but I really didn't want to go through that. So I said to him, is there any way, I said, do you have admitting privileges? And it was weird because he didn't just answer the question and say yes or no. Um, he just didn't answer it. And I thought, well, that's strange. I wonder why he just doesn't say yes, I do, or no, I don't. But I wasn't getting an answer. And so I had to ask numerous times. And I said, could you ask the neurologist in the sleep lab, who I had seen once, could you ask her if if it comes to this, would she be able to admit me on the neurological unit, and maybe they can troubleshoot this and figure out exactly what's going on? And he didn't really give me an answer. I felt like I was having to pull things out of him, and I was asking him over and over again, okay, what are we going to do about this? Things are getting worse. I don't know what to do. I don't know how to handle this. Please help me. And I don't feel that I was overly concerned more than I should have been, considering the fact that, I was getting to the point where I was completely disabled, not able to sit up long enough to make a meal for myself, not able to bathe myself. I mean, who wouldn't be concerned about that? It seems to me like that's normal if you find yourself in that position and things are not working. You're not able to do all this stuff for yourself that you used to, and you don't have a way to do it. I didn't feel that there was anything weird or bizarre or anything about my being concerned about that. I thought that was perfectly understandable. And but it was as if I was in this completely by myself. It was really strange. I remember having the feeling that my doctors, my pulmonologist, the neurologist in the sleep lab, and my primary care physician at Emory were all sitting there just sort of on the edge of their seats watching to see what was going to happen with me. But nobody was taking action. Nobody was referring me anywhere. They weren't really telling me how to handle this. They weren't putting services in place so that I could get assistance at home. And I really don't have any family that can step in and do these things, or even step in and help advocate for me. So what happened was things sort of came to a head. And, I told they were going to try to, I guess, schedule some testing at Emory and through one of the clinics. And I think initially they were going to try to schedule an EMG. And I knew that I was getting so ill and so disabled that trying to do that on an outpatient basis wasn't going to work, because I had Medicaid transportation, and sometimes you can wait hours sitting up waiting for them to come and pick you back up from the doctor's appointment to go home. And I knew that I couldn't be stuck with a bunch of needles all over my body in various muscles, and then sit up in my power wheelchair upright for God knows how long and wait to be transported home. I knew that I wasn't well enough to withstand that. And I said to him, look, can you arrange to have this done in the hospital? And his response was strange. It was almost like he was irritated with me rather than being concerned and being compassionate and going, yes, we'll see if we can work something out. Let me see what I can do. He didn't do that. He seemed irritated and annoyed at me, instead of having the reaction that people normally would have when faced with somebody telling them this. And I don't know, it kind of scared me. He seemed kind of callous, like just, well, I hope you can get the you know, the transportation to work smoothly, or something to that. Something to that effect. I don't remember his exact words, but that was the gist of it. And so as time went on, I continued to get worse. I was waking up more and more during the night with this intense faint feeling, and the lower GI spasticity, feeling like I had to poop intensely, and feeling like I was going to faint intensely, and feeling nauseated and just completely woozy. And so finally, I told him my symptoms, and he finally said, well, first he was saying, if you think you need to be in the hospital, like putting it all on me, you should go to the emergency room. And then finally he said, well, yeah, I think you should go to the emergency room, because I really didn't want to go that way. I didn't want to go through and wait for hours and hours. But um, finally he said, yeah, I think it makes sense for you to go to the emergency room. So I really didn't want to go, but nothing was getting done any other way. So I figured, well, yeah, I guess I probably better go. At least maybe they can get to the bottom of this and maybe something can get done finally. So I called 911, and the paramedics came and they transported me. They were going to take me to Emory ER, the main campus on Clifton Road, um, to the hospital there, the emergency room. But Emory radioed back to them that they were full and to divert. So they asked me, where where else would you like to go? Emory is full, so can you think of another ER that you would be your next choice to go to? And I thought about it. I wasn't really sure where to go, but the only thing I could think of is that my father, when he toward the end of his life, he was hospitalized at Piedmont Hospital. So I said, okay, well, he was always the type to take care of himself, and he would have chosen the best for himself. So I thought, well, okay, I'll go with Piedmont. So they took me to Piedmont, and sure enough, I got very good care when I entered the emergency room there. Everybody was very concerned. They were very kind to me, very respectful, compassionate. And there was a female neurologist there who was called in, and I still remember her to this day. I mean, she was very kind and she was genuinely concerned about me. And she saw that my body was very spastic. It seemed like when she did her exam, um, my my body was jumping all over the place, and even my sphincter was jumping. It was really strange. I mean, I had never experienced anything like this. And my arms and legs were jumping, and it was just very strange. I didn't know what to make of it, and she didn't know what to make of it either, but um, she was taking it seriously. She was very compassionate. She understood why I was so concerned. She didn't think anything strange about that. And she told me that she was going to admit me, and that she didn't know what to make of the strange movements, but that she was going to do her best to do a workup while I was in the hospital. And she did the first round of tests. She ordered scans, and scans of the spine, scans of the brain, those kinds of things, a spinal tap, and an EMG, and nerve conduction studies. All the things that you generally order when you first look at something neuromuscular like this that's going on, to try to assess what it is. That's just the first round of gross tests that they do. And then, if they find something there, then they possibly can diagnose it. If they don't, then they need to go on to another round of tests that are more diagnostic, that are more specific. So she went about running those tests, the initial tests that they do, and ruling various things out, which is the normal procedure. And while I was there, admitted at Piedmont Hospital, that was when they started to, they were, being in an inpatient setting, they were able to monitor my blood pressure about 7 or 8 times a day. And I think it was only really the luck of the draw, that they happened to pick up that my blood pressure was wildly dysregulated. That there would be times, even within the same day, that it would be high, or it would be either systolically high or diastolically high, or both. But a lot of times it was one or the other, and then it would drop really low within the double digits on, both top and bottom. And I was extremely, I don't know how to explain, almost stuporous. I guess that's the best way to describe it. I was just not in good shape for the first 3 days that I was hospitalized. This was in, I believe it was November 17th to 27th, I believe, 2015. And so the way Piedmont is structured, they have a lot of attending physicians that rotate, and you don't always have the same primary care physician there that's managing your care every day. You might have one day and then another one the next day, and they just kind of rotate. And the neurologists rotate every week there. So although she was my main neurologist, she was on 1 week and then off 1 week, and then her colleague would cover for her after that. And she was great. I mean, I explained to her that with some of these more painful tests, that because of a variety of things, because I have had some bad experiences, and also because I have some sensory issues, that for some of these more painful type tests, I really need to have pain controlled. Be given pain medication for those tests to make it as comfortable for me as possible. And so she was very good about that. She ordered, when I had the spinal tap, she ordered a local for that, a local anesthetic, so that when they put the needle into the spine, that it wouldn't be tremendously painful for me. And when they ordered the EMG, she ordered Demerol, and then I think a minor tranquilizer on top of that to mitigate as much of the pain as possible, so that it would be as manageable for me as it could be under the circumstances, because, of course, an EMG is painful anyway, I mean, to some extent, no matter what you do. But it was one of those tests that needed to be done in order to get some answers as to what was going on with me. So I went through these tests, and they went about the process of ruling things out. And during the process of that, I asked, just as a normal course of things, because of what I was going through. It was a very difficult diagnostic process, and I had been at Emory for a while without really much done before I entered the hospital. And, I was just having some difficulty adapting to all of this. And I asked to speak with a grief counselor. It wasn't any big clinical thing. I didn't feel that I had clinical depression or anything psychiatric going on. I just was having some grief about the level of disability that I was having, and how I was finding that I was needing more help, and I was less independent than I had been. And it was really upsetting. And I just needed to talk. I mean, they could have had just an understanding nurse come in there, and that would have been fine with me. I didn't need a big clinical assessment. There was no need for that. It was just completely situational. And so they didn't really have a grief counselor or somebody like that that could come in, but they had somebody on contract that was like a psychiatric social worker. And although I really didn't want this big assessment kind of thing, because I felt like that was kind of overkill, with what was going on. I went ahead and I said, okay, if that's all you've got, then I'll take that. But, they had this woman come in who was a psychiatric social worker, and she sat down and spoke with me at the bedside. And I just told her, I said, this has been a really difficult diagnostic process. And I said, I don't know how to handle it. I don't know what to do. I'm having to troubleshoot everything. How do I open and close doors in a wheelchair? How do I fix a meal and reach things in my kitchen? How do I take a shower when I don't know if I'm going to be able to get in and out of the tub without fainting? These are the kinds of things that I was dealing with, and I didn't know how, and I didn't have any help. I didn't have anybody to tell me how I handle those things. And so I was just trying to deal with it alone. And it was very emotionally upsetting. And when she talked to me, she said, I talked to her for about an hour. And she even said to me at the time, she said, well, can your son come and stay with you? And my son lives in Athens, Georgia, which is a small town about an hour away from Stone Mountain where I live. And he has disabilities of his own, and he's not able to drive. He has to depend on his girlfriend for transportation. And it just wasn't feasible, at least at that time, for him to come and live with me, although I would have loved for that to happen because, there are things that I can do that he can't, and vice versa. We could have been a good support to each other. But it just wasn't feasible at that time, although I thought maybe it might be workable at some point in the future. It just, you know, couldn't be arranged immediately. And she had said to me, um, you know, do you think it might be, a possibility for you to go into rehabilitation hospital, in the interim until you can find out what's wrong and, what can be done about your medical situation? And I said, I really, because I have an advocacy background and I used to investigate complaints from places like that, I said, I really don't think that would be wise. I feel like I'm in a very vulnerable state right now. And I said, I don't want to put myself in a position where I could be abused or neglected. And so, that's a very real possibility. And I said, all it takes is one staff member that is unbalanced or having a bad day and they decide to take it out on a patient. And I said, I don't want to fall victim to that. And I know what can happen because I used to investigate these complaints. So I said, I would feel a lot better having the help come into my home. And I said, I'd like to work on getting a personal assistant, a CNA, at home to help out with these things. And I said, no, I really don't feel comfortable going into a rehab hospital right now. I mean, in some respects, it sounds good and it sounds like you could get the help that you need there, but it's just too big a risk. And I said, without family coming and visiting me regularly and checking to make sure that I'm being treated humanely, I just don't feel comfortable doing that. And she told me after we talked and everything, she said, well, I just need to tell you, that I totally agree with you that you don't have anything psychiatrically wrong with you, that, this is fully situational. And she said, it's understandable. I can see why you would have some grief around losing your abilities in such a short period of time. And but she said, I just need to let you know that, I have to kind of as a formality, I have to assess you. And I realized that, you know, she couldn't really bill for grief counseling. And so she had to put down a formal diagnosis, a psych diagnosis. And what she did was she um, she pretty much chose, and I didn't know this, she didn't really tell me this, but when I got the records later, I realized she chose the simplest one, the most innocuous one that